This is Radio Health Journal. I'm Nancy Benson. This week, using artificial intelligence to help pick treatments, but it won't replace your doctor.
The machine can't tell you which treatment is going to work best for a particular patient, but it can narrow it down to a dozen or so choices.
How big data can make medicine better when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The thing is, we don't really have to choose. We don't have to be like, oh, I'm either going to be really fit or I'm going to have desserts and not be fit.
Cutting sugar from your diet doesn't have to be as restrictive as many assume. Then,
most of the interviewers and most of the interviewer/photographers were white. And here these people were being asked by white people for the first time in their lives what they felt like, what they experienced.
We take a look at the intimate portraits of those formerly enslaved. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Google, Facebook, and your internet service provider know a lot about you. Every time you click on anything on your computer or smartphone, it's one more piece of data about you. Put all that data together, and it makes a fairly complete dossier about you. Multiply that by hundreds of millions of people, and you have a goldmine of information about society as a whole. But while big data and analytics are changing the world, one industry that's lagged behind is healthcare. It's true that most doctors put all your information into an electronic health record whenever you visit, but most of that record just sits where it was collected.
This is a big challenge in the industry. And the commonly used term that refers to this challenge is interoperability. So when we digitized patient medical records through the Affordable Care Act and the HITECH Act and so on, put it another way, we forgot to ensure that all of these new systems, these electronic health record systems, would interoperate. In other words, talk to one another through a common set of data exchange standards.
That's Patty Padmanabhan, CEO of Damo Consulting and author of the book, The Big Unlock, Harnessing Data and Growing Digital Health Businesses in a Value-Based Healthcare Era.
We are now, in hindsight, retrofitting a set of standards, but it's slow going. And it's also now complicated by the fact that the data sources have vastly multiplied. So you're right. Your physician that you go to, your primary care physician, his or her practice doesn't necessarily talk to the hospital down the road where you might be referred to for a procedure.
That means that the clinic has to start over on your health history. What's more, none of your previous illnesses and treatments are likely to be put anonymously into a national database to help doctors figure out what treatments work in the real world. But Padmanabhan says a variety of factors are pushing healthcare to get into big data in a big way. One is the transition toward evidence-based care. And while healthcare providers have more accountability today for the end result of a health transaction, consumers do too.
You and I, we didn't have a lot of choice earlier, and we didn't really care because our employers paid for insurance, so we could go in and consume as much healthcare as we needed to. And health systems didn't really need to tell us what it costs to do anything, whether it's a hip replacement or whether it's just a routine annual physical. They were billing the insurance company, and the insurance company was paying them. Consumers are now taking more and more responsibility, financial responsibility for healthcare costs. And that in turn is driving them to look carefully at the choices that they're making.
Once data sources are linked up, the amount of medical intelligence could be exhaustive. So exhaustive that Padmanabhan says artificial intelligence will likely be used to sort it all out, though it won't replace your doctor.
The amount of medical literature and research that's getting published is humongous, and it's humanly impossible for any one oncologist, no matter how skilled they are, no matter how on top of their profession they are, to stay on top of all of the emerging literature. So to help kind of narrow down your diagnostics and treatment options, you can use emerging technologies such as AI to help, crawl through tons and tons of literature, medical literature, combine that with structured data such as your electronic health records and with your genomic data and everything else, and make intelligent conclusions about the possible range of treatment options and present those to you.
But where would all this information come from? Most people could imagine using insurance claims and electronic health records, but other sources could be troubling if you'd prefer they be kept private.
For example, Internet of Things, smart devices. These are now ubiquitous, whether it's your Apple Watch, your Fitbit, or a glucose monitoring device that you wear as an implant or on your wrist. And all of these devices are now smart and are throwing off data. The data can be used along with the health records and your medical records that sit with your physician or your hospital to make improved judgments about your medical condition, whether to intervene with you if, for instance, your glucose levels are progressively shifting in the direction of a possible diabetic situation, just to use one example, and a variety of such use cases.
And if you've had your genome sequenced, which can be done for less than $1,000, Padmanabhan says that's a treasure trove of information too.
That, in combination with your own personal medical history, can inform your doctor in ways that just your medical history alone wouldn't be able to.
Sometimes information like that could be life-saving, or it could be used against you. For example, if an insurer gets a hold of it.
I was talking to the CIO of a nationally known health system that I can't name, but this is exactly the challenge, the conundrum that they're grappling with right now. They did a small pilot where they looked at genomic data and looked at the medical histories of a small population of individuals. And they could tell with almost near certainty that there was a percentage of the population that they could identify that were at very high risk of Alzheimer's, but they were not yet diagnosed with Alzheimer's.
Padmanabhan says cases like that illustrate why security fears have also helped to slow down the use of analytics in healthcare. Strict ethical guidelines could help police access, as could the use of blockchain technology, like that used to secure Bitcoin transactions.
It's a very different way of maintaining records, transaction records, among other things. And so think of it this way: if you were managing financial transactions with your bank and you had an immutable record of the transactions that everybody agrees upon and cannot be changed in future, and it also gives you a clean trail of the different transactions that have taken place on a particular asset. That technology is blockchain. It's still very early, and the applications in healthcare are in very, very early stages, but one possible application is in putting together electronic health records or patient records in a blockchain-enabled environment and then sharing it with anybody you like.
Padmanabhan says he's optimistic that all of this could happen in the next generation, if not sooner, resulting in more effective treatment at a better price. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
About 1 million Americans have Parkinson's disease, and many are treated with levodopa-carbidopa therapy, but about half of them will experience off episodes when Parkinson's disease symptoms return between doses of these medications. The FDA has approved Norianz, Istradefylline, a prescription medicine used with levodopa and carbidopa to treat adults with Parkinson's disease experiencing off episodes. Dr. Robert Hauser of the University of South Florida says,
During off episodes, symptoms including difficulty walking return, which can impact patients. Norianz is the first and only treatment of its kind that works differently. In clinical trials, Norianz significantly decreased the amount of off time that patients experienced and increased the amount of time patients had good symptom control between doses.
Norianz may cause serious side effects including uncontrolled sudden movements, dyskinesia, hallucinations, and other symptoms of psychosis, as well as compulsive behaviors and an inability to control them. The more common side effects of Norianz include uncontrolled movements, dyskinesia, dizziness, constipation, nausea, hallucinations, and problems sleeping, insomnia. If you or your family notice that you are developing any new or unusual symptoms or behaviors, talk to your healthcare provider. These are not all the possible side effects of Norianz. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Before you take Norianz, tell your healthcare provider about all your medical conditions, including if you have a history of dyskinesia, have reduced liver function, and smoke cigarettes or use other tobacco products. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Norianz may affect the way other medicines work, and other medicines may affect how Norianz works. To get more information about Norianz, consumers can call 1-800-NOURIANZ or go to www.norianz.com. Brought to you by Kiowa Kirin.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
That calls into question this idea that all we need for healthy eating is just to plot more grocery stores into food deserts.
A challenge to public policy on how to get people to eat healthier.
Then immortality, or living so long, you might as well call it that.
This is not snake oil, this is science. And that's probably, again, one of the reasons we use the word immortality, because to differentiate it from simply living another 10 years or maybe 100 years.
All that and more on Radio Health Journal.